Good evening, viewers. Before I say anything, Dr. Pramod Chinder and myself, we have both received 2 doses of the COVID vaccine. We are safe and trust all of you have received the vaccine. Stay safe. I'm Dr. Aftab Ahmed, Senior Consultant at Sukino. This is a Sukino Health Capsule. We call prominent doctors who will impart their knowledge to us, who will give us a lot of information on the various medical conditions that we come across. So let me go to my guest over here, Dr. Pramod Chinder. Welcome, sir.
Namaste, sir.
Thank you very much for giving us so much of your time. You will always be welcome to Sukino at any time.
Oh, thank you very much.
Dr. Pramod has done his master's from Bangalore, where he did his initial studies on orthopedics. And then he went on to do his fellowship in musculoskeletal oncology from Italy. Further on, he went to do his fellowship in hand reconstructive surgery, again from Germany. There are a lot of things that he has done. It will take a lot of time for me to go through all of them. But what's important is we're going to hear a lot from him about oncology related to bones. Welcome once again, doctor.
Thank you, sir.
So let me start, sir. First of all, there's a lot of confusion when we talk to the normal people and we talk about tumors. The first thing that comes to their mind is, oh my God, cancer. So could we just let them know that how it is?
So as I said, first of all, thanks to Sukino
You're welcome, sir.
Welcome. For this opportunity to share about one of the very rare problems in the healthcare.
Yeah.
So it's like bone cancer. Essentially, this bone cancer or bone tumors occurs mainly in children.
Yeah.
So they range from 5 to 15 years. We have seen as young as 5 months, 6 months.
Oh.
So they are as I initially said, they are benign and malignant both.
Yeah.
So benign means they are not dangerous. Malignant means they are dangerous. Dangerous why? Dangerous to life if not treated. So 90% of the bone tumors or cancers are not dangerous.
Good. That's really good. So viewers, 90% of tumors, when you hear of them, don't panic. Only 10% are bad and doctors are there to take care of it. But you have to get to them early. Let's go ahead, doctor. When we talk about these tumors, are there any genetically related factors? DNA, anything with that?
Yeah. See, all the all the tumors or the cancers are all one way or the other they're genetically related.
Yeah.
Genetic does not mean hereditary.
Okay.
So what I mean is every cell has got a gene.
Okay.
And the change in the gene causes the cancer.
Yes.
So every cancer has got the gene problem.
Okay.
So that does not mean that if in my whole family, if I don't have any cancer, if I get a cancer, doesn't mean that
the siblings will have it or somebody in the family will
it's
get it.
90% of the time genetic, it need not be hereditary.
Okay, that's again good news. That's like stroke. We have a lot of risk factors: cigarette smoking, obesity, sedentary lifestyles, hypertension, diabetes, renal failure. Do we have similar precipitating factors? Though, like you just said, that most of the tumors occur in children and they don't belong to this category, but there must be some precipitating factors.
Yeah. This has...
Could nutrition play a part?
Yeah, absolutely. I was coming to that point. So nutrition is one of the very important thing what we have noticed. I think the early stages when the child is growing, that means the children will have 2 growth spurts.
Okay.
One between the 5th to 10th year, the other spurt happens between 12 to 16 years depending on the boys or the girls. Boys have it a bit later than the girls. So during this growth spurts are these problems which we have seen. That means when the bone starts growing, so if it is not repairing well, if the cells are not, fail to repair by themselves, then they become rogue.
Oh, okay.
So these are the 2 times we have seen where they have a problem.
A very important question I'm going to ask you. A breast cancer, there's a lump. So the woman feels it, she tells her husband, you get to the doctor, you do a mammography. Similarly, if it's a CA stomach or CA lung, there is either hematemesis, hemoptysis, bleeding, and there are signs. But here now we have young children. How do we get to know there is a bone tumor? How does the mother or the parent even has a slight clue that this child may be having a tumor?
Yeah. Dr. Aftab, as you rightly pointed out, breast cancers, as a lump is a screening sign. So like that, not many people are aware that there are certain screening methods for this also. As I always talk, if at all if somebody is taking a good point from this whole session, this point they should take home. Any child which is waking up more than 4 times a week in the middle of the night because of a pain in the knee joint or the shoulder joint, or if this pain is not coming down by the regular dose of analgesics, or if you find in history that a child is visiting many doctors because the pain is not going down, so then that is a case to be thought about, that there is something problem happening in the bone. So then MRI is the key, not the
must get to your doctor.
2021 is MRI.
Wow. So please remember, viewers, it is not Zandu Balm that's going to take the pain away. You have to get to a good doctor and get an MRI done.
Yes.
Yeah, that's great. I mean, that's real good information. Yeah, I have a couple of other questions to ask you. When we talk about bone cancer again, normally we'll always, if you go to a general practitioner, he will always look for the primary. So here in this case, the primary is the bone. Does it similarly spread to other organs? Which are the organs commonly involved?
Yeah. See, primarily the organs which are involved are the knee joint and the shoulder joints.
Wow, that's so sad.
Okay, and they spread to lungs.
Okay.
General, these are the common. In say 70% of the individuals.
Okay.
So usually they are in the knee and the shoulder. So they can go to the lungs is the commonest site to go, and it can go to other bones also.
Yeah. All bones are equally affected, the long bones, short bones?
No. Long bones, as I said in the beginning, it's the growing bones.
Yeah, so okay, it's only mainly the long bones.
They grow in the knee joint.
Yeah, great.
If you remember our anatomy teaching, so we were taught to the knee I go, and from the elbow I flee, shoulder and knee I flee. So the growth happens here, and here. Yeah.
So once the child comes to you and then you have detected this, so next what is it? How do you explain to the parents about this? Because it's a very painful thing to tell them about these cancers.
Yeah. So, see, first, as I said, once many people come with a lot of apprehension.
Yeah.
First of all, one child era now, and they're so stressed, and with plus Google, you add.
Yeah.
So imagine the amount of stress.
Absolutely.
They would have not slept for many weeks. So, as I said, first, there is no emergency in cancer.
Okay.
There's only urgency.
That's real good news. Okay.
There's only urgency. When you need urgency and emergency, you should be able to. Urgent means you can relax and work out as early as possible. Emergency means, tomorrow we do something. There is no need to panic.
Okay.
Nothing, panic off. Okay, because if you treat any bone, even the most aggressive bone cancer, 70% of them are curable. 70.
Wow, that's really good. I mean, that's good news.
Yeah.
That's real good news.
So why do you worry about it? Why do you worry about the less than that 30% of it? Let's keep 70% of my glass is full. Let me find out how.
I'm sure since they are children and then it's bone cancer, particularly affecting a knee joint or some joint, the surgeries must be pretty complicated.
Yeah. See, this whole process is complicated. This whole process is about a year's issue. Okay. So surgery also takes about 8 to 10 hours.
That's long.
And sometimes goes to 2 days, sometimes we have operated for 3 days.
So 3 days, will you take a sleep in the night?
Yeah.
You take a break. Okay.
With beautiful anesthesia nowadays.
Okay.
We operate for 8, 9 hours, 10 hours. So because your mind is at fresh.
Yeah. That's good. So you have been doing some exemplary work in this field. So can you give us some classical cases which you have come across? Some outstanding surgery that was done and a good recovery, 100% recovery?
Yeah, lots of them. But I should say a recent one was an example which a child of less than a year on just before 2 days prior to her birthday.
So sad.
Yeah, she got the news that she's having a bone tumor. Okay. And they do not come from a very good economic background.
Okay.
And the only solution was an amputation.
Oh.
But we happened to save the leg of that 1-year-old child who has never walked in life.
That's so wonderful. Yeah. I mean, that's an amazing thing that you have done.
And the whole thing was funded by everyone, crowdfunding, my friends, my doctors, and 25 lakhs we could generate just by funding.
Wow.
We generated the funds, and today the child is in the 6 months later, she's climbing stairs, and
I mean, that's an amazing story, I tell you. That's wonderful. Especially this part where all your friends came out to crowdfund and at bad expenses.
Across the world.
I mean, that's really good. We still have a lot of good people and a lot of wonderful doctors like you. Yeah, so we'll go on to, can you describe one of your most successful medical cases and what factors contributed to your success? So why do you take up this part of the profession?
Yeah, see, when I finished my post-graduation, I never knew that I'm going to do an orthopedic oncology. Only when I was in Singapore, my Professor Robert Fo. So when I used to see the follow-up patients of them, they were moving their limbs and everything, they're happy, they're air hostess. And what we were taught was like osteosarcoma means death or amputation.
Yeah.
So there is an osteosarcoma patient who's absolutely fantastic being an air hostess.
Okay.
Then I said, okay, let me take up this profession.
Oh, that's how you got into it.
And success, as you said, it is not one person. Never. Okay. It's not me. It's a team.
Entire team.
No, it's. I would not say I'm the man. There are other people who are the team. No, it's equal.
It's we. We are the team, and we do it together.
I say nurse practitioner, or physio.
I mean, I'm glad you're mentioning nurses because most people don't really feel that the nurses do too much. But I think a lot of work is done by the nurses, and I'll come later on to the physiotherapists. I'll come to that. So how do you keep a track of all your patients, and how many follow-ups do you have for each patient? How do you manage this?
Yeah. So most of the patients are tracked, as in most of these patients we have long-term relations, because once they are in for a 1-year treatment, we tell them to come every 3 months for follow-up for 2 years, and after that every 6 months for next 3 years.
Okay.
So in 5 years, if the disease has not come back,
then that's great news.
That's cured.
Good news.
They are cured.
Oh, wow, that's awesome. How many amputations have you done?
You should ask the other one. How many limbs have you saved? You should not ask me the question which I don't like. I don't do amputations.
Okay.
I do amputations, but in a very critical setting. My job is to save limbs.
Great. That's wonderful. That's a wonderful answer also. Yeah. Okay, that's great. Are all your patients open to suggestions on rehab? Like, don't you think that rehab plays a very, very important part in post-surgery, post-radiotherapy, chemotherapy of this oncology, the cancers?
Yeah. I think the most neglected part is that, and the most successful outcome is mainly by the rehabs. There's no doubt about it. And that's how from the day one we have developed our own home care. From beginning days, I'm telling. Because when we say the rehab, it cannot be a general rehab, it cannot be a general physio, go to do. No, why do you
Not somebody coming home and you have to go to an institute.
Where and the professionalism. The professionalism is very important. Connect to the main thing. So
absolutely. I think we have a very professional setup of, we have 34 physiotherapists and all skilled and trained in this kind of work. So physiotherapy absolutely plays a very, very important part. I'm glad we started this kind of a setup over here.
Much needed, as I said.
Absolutely. And I think we need a physio rehab in almost everything. Post cardiac surgeries, post knee surgeries, post anything. Absolutely. Rehab plays an absolutely important part.
Absolutely.
Yeah, great.
No doubt about it.
What are the challenges you have faced? Unfortunately, there are only 2 or 3 centers in the entire country. So, do you think more centers should come up? Is there any plan on this?
See, my thought is the center should have a policy.
Okay.
And because this setting up such specialities, it's a very complex thing.
Yeah.
And it's not very well paid.
Yeah,
because it needs more of a passion, team. So somebody has to support.
Absolutely.
Yeah. So the policy has to come, and of course, with 1.3 billion population.
Yeah.
We have.
There's a lot that goes undetected.
And if it is managed by somebody in a nice level, and I don't see there is no. It is definitely a sustainable model, and we in India can attract a lot of patients from across the world for such top class care.
Yeah. So we talk so much about bone tumors. What about musculoskeletal problems that you deal with?
99% of my work happens around bone tumors.
Okay.
So I really deal with musculoskeletal problems, which I was doing it before, but now I do only tumor work.
Okay.
Because this consumes
a lot of time.
Yeah, and
like you said, 3 days. Some of the surgeries take. I mean, so next 30 days you have to sleep. Yeah. So how do you stay updated with all the new treatments and all the advancement in this kind of surgery?
Yeah, I mean, as I said, this whole specialty is not very common. It's rare. Likewise, it's rare in the world. So we are a very close-knit group of 300, 400 doctors around the world.
Okay.
So we meet about every 2 years
so you'll have this oncology conference.
It's a very small society,
okay.
but very closely knit, very open. So we exchange knowledge, we travel. So this make after joining this specialty.
So you're really enjoying this. You're enjoying this work.
The whole world is one.
Okay.
So I can I have friends in all parts of the world now. Japan to Colombia to Brazil to.
Okay, next time when you're going there, take me along also.
Anytime.
Is there any special information or message you'd like to pass on to our viewers?
So with regards to the, as I say, with this event, I would say, so when we take outcome of any disease, this is a bone cancer one, it's a very small specialty. The viewers are from the various perspectives. So do not neglect the rehab program. Of course, the primary doctor may be superb. If the rehab is not done well, if the aftercare, if a good antibiotic is not given in an aftercare, or if the good nutrition is not given in an aftercare, or if the good positive environment is not there in an aftercare, it's it's a sick feeling. Like I sent a last patient who went to Sukino. So they are very well to do family.
Okay.
They have a home here in Bangalore. But see, somebody needs that initial post-surgical care for about 2 weeks, 3 weeks.
Absolutely.
To get them back to their toilet activities, get them to car, get them to business, get them to their profession.
And you got a team. You need a team to do this work for them. It cannot be a single individual physiotherapist coming home. It'll be very difficult if it's a patient weighing about 120 kgs, how is the single man going to hold him, lift him? So you actually need a real physio team to take care of all this.
In olden days, it was okay to join families.
Yeah.
There's so many children. Now it's one nuclear family with a small kid, one kid, and essentially it's logistics.
Oh yeah, really. I think I'm really happy that we started this and we have a lot of things. So is there anything else you would like to say about this? Or
about the home care?
Yeah.
See, I mean about I would say step down care. I would not say
step down care.
See, the step down care is for any doctor. They should never feel that they are losing away the patient or the
That's such a noble thought from you.
No, you see, Vasudhaiva Kutumbakam is what we believe, right?
Oh, yeah.
So the whole world is one.
Yeah.
So you have to just take the best of everyone.
Yes.
See, and if you assign certain things to certain people, so you are rest assured that your focus is on what you are good at. Like I'm an orthopedic oncologist surgeon.
Yeah.
If I know that this patient has to walk to bathroom in the next 5 years, give them the goal. This is the lay and outlay. So all these things has to be handed over by individual person. Okay. But if you can put all this thing in a platter and deliver it like what you guys have done it.
Yeah.
So I can sleep happily.
Thank you. Last question, it just came to my mind. Anything about the stem cell therapies?
Yeah, I mean, stem cell therapy is a very vast word. It is like how's India.
Okay. So, but do you use any of this for your?
We do. See, in where we do maximum work, where I work is mainly in HCG hospital, where orthopedic oncology, we started this. We have a wing called iCrust, where the stem cells have been used for the bone marrow transplants.
Yeah.
So then, when we were exposed to that, we got an lateral thinking of using stem cells to various other causes to our family and friends in the beginning.
Okay.
So we started using the platelet-rich PRPs,
which
is used in the rehabs. So stem cells for other spinal cord injuries, osteoarthritis of the knee joint.
Yeah, and this is what I wanted to come to. Is it really proven that stem cell therapy?
Absolutely. Not stem cells therapy alone. I'm telling you, regenerative therapy is the word.
But is it being done in Bangalore?
Yeah, absolutely, we do it.
Oh.
It is, but we don't have time to promote that and do. But my mother, She was 62 when I started. She was about to go for a knee replacement.
Yeah.
A friend from Italy, he was doing a fellowship with Dr. Somana. I was in his right now has to. He said, dude, you can check this out. They can give a PRP injection to the knee joint.
Okay.
So when I did that, so she is now 70.
Yeah.
At 62, she was unable to climb one stair. Now at 70, she climbs 3 stairs.
That's wonderful.
And our knees are not replaced yet. I mean, it's the
Just so that people can understand this, the cost compared to a total knee replacement and your stem cell therapy, how will they?
No, you cannot, by costing, you should not decide whether he wants to go knee replacement or a stem cell. So both have got their own indications.
Yeah.
So
But they're successful.
I mean, they have equal, I mean, it's knee replacement is needed for certain individuals. Early knee problems, you need regenerative therapies.
Okay.
You should case selection. So, and costing, I say,
Is the last thing that you should think of.
I mean, it's not very expensive. I mean, if that is what you're asking for, it's not very expensive.
Yeah, because there are a lot of people who don't want to go for the total knee replacement and they don't know what is the next choice.
So, what's your regenerative therapy? There is no drug.
Yeah.
It's your own body cell.
Okay.
It's your own cells. So how do you pay it?
Yeah.
You don't have to pay it.
Okay, that's good. All right then, viewers, thank you for watching us, and I'm sure you've got a lot of information from Dr. Pramod. And before I wind up, it will be unfair if I once again don't say the war on COVID is still on. Do not take it easy. You still have to wear your mask. You still have to maintain social distancing. And for God's sake, those who have not taken the vaccine, remember, if we all have been vaccinated, it is good for the younger generation, for our own young children. So please take the vaccines, stay safe, and we'll be back with some more in a couple of days. Thank you very much.
Thank you. Thank you.